my dear girls. Today's lesson is osteopathy lesson for the maxilla, cheekbone, nose, and the jawbone. We will be bringing our face into the harmony. We will need table and gloves. I hope you already did the facial balancing routine and facial asymmetry number 1, because this is the second step to it. I need to also remind you that the jawbone, the maxilla bone has to do a lot with the function of your mouth. Your chewing pattern, swallowing pattern, talking habit, right? This is all plays a part, especially your tooth health. If you have grinded tooth, if you have different height of the tooth, if you're missing tooth, all of this plays a part. And of course, osteopathic techniques, massages will definitely prevent it from getting worse. However, if you want to significantly change situation, you would need to work with a pair with the dentist. And without saying any more, we will start with neurovascular release. Slide your hands on top of your sternum, turn towards one side, the same side that you turned on. Try to start lifting your ear, elongating back of the neck while hands are sliding, but they don't really move, on top of your skin and fat. And here, when you feel the first amount of pull, you're gonna take inhale, making sure that your chest grows higher and higher, and exhale, stretching this. Then take back to the neutral. You can compare sides. Definitely this side should be easier to go. Now again, sliding your tissue on top of your sternum, turn towards another side. Start lifting the same side that you turned the ear. And once you feel the first stretch on the side of your neck, you're gonna continue sliding with your hands. Take a huge inhale with your nose, making sure that your chest goes up. And exhale, making sure that the chest goes down while sliding and feeling very nice, not the muscular stretch. Very good. Now you're going to take this chest, your chest muscle, and with moving your hand like this in the circle, just holding the chest, you're going to relax and not only activate the lymphatic, but also address your ribs and the muscles that connect to your ribs. A lot of rib asymmetry comes back to the jaw asymmetry due to the connection not only from the back, front, side, but also from the deeper connection. So let's just address it and tell the body that we have the sides and we want them to be neutral and balanced compared to each other. Great. Now you're going to side, just touch your neck a little bit from the side. Then go to your underjaw. And when you arrive here, you're going to take your down with this position. We're gonna place our elbows on the table. Take our occipital bone, which is here, just like that. This is your ears. It's going to go like on the middle of your ears. And while you're here, you bring your nose down and you feel like you're creating a compression. Your hands are not moving on top of the tissue. You slide it and you feel in the bone and you put in the compression through your body, not through your wrist. It's absolutely not painful. It's all about the intention. And once we're gonna stand here for 30 seconds, then we're gonna move our hands apart, again the intention, and move our nose apart, growing from the top of our head, feeling like our bone is getting more space, but your fingers are not traveling. This is not the tissue work. Arrive here, place it on top of, you can move your butt a little bit further, and then take a breath, feel your bones, give your hands a couple seconds to arrive on the bone. Relax your fingers. Start bringing your hands into the compression for 30 seconds. Your nose slowly, 1 millimeter after millimeter, moves down, and that helps you to create more compression. You breathe, you're feeling maybe tightness around your neck, maybe not, but you're feeling the bone. You might feel the warmth around the bone. And now your hands take in different direction. They move apart from each other, and your nose slowly start growing up, like somebody is lifting you. Relax your fingers, give that space, for your occipital bone. Move your occipital bone into your hands, like you moving, pressing your head, making it go. Your occipital bone has more space. Now we need to start with our gloves because maxilla bone is inside and better be addressed from the inside. And we're going to be working with this suture. With this suture, we're gonna work like this. We're gonna hold our maxilla bone here and our frontal bone here. So we will work cross of this. So my first side is on my right side. I'm not going to apply much pressure. I'm not gonna push anything. I'm just gonna hold my maxilla bone like this. You see, maxilla bone is actually two bones. It has a suture around it. So I'm gonna hold this side. I'm not gonna hold my teeth. I'm holding my bone. Okay. I'm not dragging my tissue. This is important. I'm on the bone. My hand is with the support. And now I'm gonna put another hand here and I'm just gonna hang here. And I'm gonna take breaths, and on inhale I'm gonna do anything, and on exhale I'm gonna move a little bit with intention, my hands apart. Okay. I hear. Don't do anything here. So if you need to, right here, and let's breathe. Relax. Obviously, I will not be able to talk when my hands are in my mouth, and I really want you to understand that this is the techniques that has to have no internal or external noise. And you already might feel or have a feeling of your nose bridge getting higher, and we're going to go on the second side like this. Hold. Great work. Now we take the finger and start working on a suture, just softly massaging it on top of your palate. A little bit vibration, a little more circles. Very soft. Now we're gonna pull our tongue and move our head to the different side. And the side that it feels harder, you're going to move opposite, stay there for 15 seconds, and go back to the harder side. So, for example, I feel like this one is tighter, so I'm moving opposite direction. I'm giving this tissue slack for 30 seconds, and then I move towards the side to stretch it. Huh? Ah. Very good. Now you're going to go into your ear and into your maxilla bone. Good moment to check which of your maxilla bone feels a little bit higher than another. The one that feels higher, that's your second side, and the one that feels lower, first of all, it could be your anatomical, discrepancies. We are not meant to be symmetrical. However, start with the side that feels a little lower, because obviously we want to bring it higher. That's when you get cheekbones, and then you can have the cheek apples. Otherwise, if you don't have cheekbones, no matter of the amount of tissue on top, you're not gonna have that pronounced cheek apples. Super important to work on the maxilla. So what you're going to do, you're going to find this right behind your ear and place your finger in here. You're going to take it like this, and you're going to take your maxilla bone, and then you're going to bring it together for 30 seconds. Again, we bring in the bones into the compression. Into the compression, we are not pressing them, no, we just bringing them into the compression, kind of going away from them, letting the hands bring together. And then after 30 seconds, or if you feel like you need longer, but definitely you can't need less. If you feel like you need longer, stay longer. But then you're gonna go and move it apart, growing from your top of the head. The same idea, the same osteopathy principles apply. Compress, apart. Bring them apart. Grow. Very good. You might feel your sinuses better, you might feel the whole face functions better, because this is the area between your temporal bone and has a lot of important structures that coming up from here. So giving it space, it's just the best feeling ever. Now you're going to do the same with the second side. Let me clean my gloves. You can change your gloves. I'm cleaning them. Take it. First you compress, second you move it apart. Move it apart. Move from your body. This is not the hands effort. Now we're going to do the same. I'm gonna do a little bit longer on the side that is lower. You can actually check right now if you feel like it more neutral. I definitely feel a little bit less discrepancies. And now when we're going to bring it into the compression, we're also going to vibrate, but not with our hands, more like with our body, from our elbows, right? There's difference between this and this, okay? Enter, you will feel something firm. This is what you're pressing into. Don't go too far to your brain, okay? Compress. Bring your body into compression. Vibrate. open. Very good. You might feel like you need to yawn. You might feel like you want to sneeze. This is normal. No pain. You should not feel no pain. You might feel, oh, this becomes itching. This is normal, but it cannot be pain. Let's go second side. Let me do this. Compression. You hold in your bone like this. Open. Very good. If you feel still a big discrepancy, you can do one more time on the side that feels more compressed. Now we're gonna go into the nose situation. Nose. So you put the mirror right here and you see which side your nose, your tip of the nose goes. Obviously, sometimes it's a cartilage, but usually it's the maxilla bone. It's a maxilla bone compression or rotation. What you're going to do, you're going to hold if your nose looking towards this side. We're gonna play if the nose looking towards the right side. You're gonna hold with the left hand your left maxilla, like that. And your right hand will be standing on top of the right nose. So your nose looking like this, your hand is on top, the one's the same side. The opposite side is inside holding the maxilla. What you're going to do, you're going to start moving your head towards the same side where your nose is looking, towards the same side that the hand is on top. Very slowly, you're going to be moving, and by biomechanics, your nose actually going to be moving opposite. And here the hand giving the maxilla what it wants. 30 seconds. You are not pushing the teeth. You are not pushing anything. You're working with the nose. For the nose, this is a great exercise. I would do it the second time. You can already check. Sometimes it's working pretty well, especially when all sutures and everything is worked well on the scalp. Let's go it again. Amazing. Remove your gloves. Very good. Now place your hand, open your mouth, find the upper edge of the masseter, place your hand like this below your zygomatic arch, and you're gonna hang. You're gonna hang like this for 1 minute with me. Like this. Breathe. Don't press, just the weight of your head is already lifting your zygomatics. If you feel like one side is definitely lower than another, you can give it a little bit more weight of your head. I feel this is lower. I'm gonna just give it a little weight of my head. More. Breathe. And hang. You need to hang here for a bit. When you feel like it's enough of asymmetrical, go back to symmetry and just hang here. Continue hanging. Continue hanging. Relax your hands, relax your fingers. Your hands are just supporting your bones. You're breathing, you're imagining how all of these bones right now breathing with you and taking more neutral, more harmonic position. Continue, stay here. Continue staying here, give it time. This needs time. Relax. Work with your fingers if you need. You will feel your cheekbones higher today, but again, this is you can't feel pain. You have to feel just lift and inner peace inside. That's what you need to feel. Now we're going to do the same with our forehead. Place it like this, and we hang for another 2 minutes on the orbit. Bring your chin down. Relax your fingers. They're not pressing, they're holding your forehead. They're holding your forehead. They're giving the space for superficial vessels, for all of the deeper vessels, the sinuses. We're working right close to the area where the dura mater from the inside. We hang here. Don't think about your potential that you feel that your corrugator is tight or there is another tightness as a muscle tightness. I want you to turn these sensors off. I want you to feel you are holding the bone and you're just letting it hang. You're letting it hang. Just like that. You can look down, you can look up, sides. Your eyeballs not even touching your hands. If they're touching, change the position of your hands. Stay here for a little bit more with me. Bring your chin down, more down. Relax. Now take your fingers right here and again with the vibration through your hands, start vibrating right here, right on the inner orbit. Moving the vibration inside, sending it towards this shenanigans that is happening here with the bones and sutures. You're putting it inside. Very small. Imagine it. Don't imagine like they're getting shaked. Imagine that they just like a wave happening. Not a tornado, please. Just a little wave. Very good. Now we go into this suture. Super important for the eyes. Right here. It will feel right here, the suture. And place your fingers here, and again with your other hands here, just hang like that. A little bit like sides, but make sure that you're not touching your eyeball. And breathe. You're lifting that part of the forehead. And you're lifting your cheekbones by doing this, surprisingly. This is where your cheekbone connects. Breathe. I'm not thinking about my tissue that fold or anything. I'm thinking of my bone. And relax. I hope you enjoyed this routine. The goal would be feeling very quiet afterwards, and of course seeing more harmony in your jaw, in your cheekbones. You can repeat this 1 to 2 times per week. Don't forget about other routines, because as you can see, we have a lot of bones and a lot of sutures, but this one was more oriented on the maxilla. I cannot wait to hear your feedback, and I hope you all enjoyed it.